Prostate cancer is a very prevalent disease in our communities, and a certain percentage of them can be low grade and low volume, but a percentage of them can be aggressive disease, which can then become metastatic. So in men who do have prostate cancer, which is advanced, we can offer them the testing and the treatments which they need, which will help assist in their care. Generally, when we see patients in our office in the Advanced Prostate Cancer Clinic, it's a patient who's already been diagnosed with prostate cancer or who presents with a very high PSA and findings which are concerning for metastatic disease. When we see them, then we'll subsequently do the testing based on the individual to get more information to know how to best treat them and evaluate them. So the advanced prostate cancer patient generally will have had a primary therapy already, be it radiation or surgery, and then oftentimes their PSA will have started rising subsequently. In that case, that's an indicator that there's prostate cancer cells within that patient's body, which is now growing after the primary treatment. The next step therapy is generally hormonal therapy. The treatments for the advanced prostate cancer patient can be androgen deprivation therapy, which is classically a shot, sometimes surgery, which is removing of the testicles to bring the testosterone down. There can also be pills, which are in addition to the basic hormonal blockers. These are what we call advanced hormonal blockers, and that can extend men's life by adding those pills when it becomes fairly significant disease. We can arrange for the medications for those patients, be it the shots here in the office or the pills which they can take in their home. The treatments themselves, they do come with some side effects. Typically in the hormonal treatments, men will experience hot flashes, they can have osteoporosis if it's long-term, they'll have a sense of blasé, some fat redistribution around the midline. There's some exciting new therapies which are in the works. There are therapeutics which use an antibody to PSA. So if we can attach either a radioligand, which is radiotherapy, to an antibody which targets directly to PSA, then that radioligand goes only to the prostate cancer cells. And so therefore it will only address those. This is a newer treatment, which is an exciting area. We're seeing medications which are going to be coming up, and I think that is the future of the advanced prostate cancer treatment modalities.